In this section of training, we're going to discuss the topic of assessments. We'll look at the different types of assessments and what kind of information they're designed to provide to instructors. We'll also look at the Indiana requirements for dyslexia screening, or Senate Enrolled Act 217. We'll also point out some assessment tools available at no charge for educators. Let's begin by going over some important terms. In this short segment, we're going to explore the difference between a criterion reference test and a norm reference test. Let's begin with norm reference tests. Think norm-referenced normal. The idea is to get a nice sampling of students at about the same age or grade range, yet very diverse, to take into consideration socioeconomic and ethnic diversity. This will give us an idea of what an average student with those skills might look like at that moment in time. So once we have this group or this norm, which should be large enough not to skew our data, then our goal is to identify whether or not the student that we're assessing falls within that normal range or average range on that set of standards. When we administer a test like a norm reference test, we generally are trying to answer the question of how our student is performing. Are there areas of weakness? Is the student showing that there might need to be a special service, either to enrich or to intervene for the student? Norm reference scores are often communicated in a way that can be confusing if you don't understand the idea of a group norm. Oftentimes, students receive a score that's a percentile. When we think about percentiles, it's important to know that that is not the same as a percentage. So students that score at the 70th percentile are not students that have scored 70% of the items correct on the test. They are students who scored above 70% of the group. For example, if our group size was 5,000 students, those who scored at the 70th percentile scored better than 70% of that 5,000, if they were compared to that same group. That would tell us that the student is well above average, or at the higher end of average. Students who scored at the 50th percentile are average. And again, that may be challenging for educators and parents to understand if they don't have the background on a norm reference test. Historically, when we hear 50%, we don't understand that percentile is different than percent. We think 50% F, the student is failing and they're not doing well. But in a norm reference test, 50th percentile would be well within the average range. When we use norm reference tests, we're often looking at how the student performs related to peers. When we're thinking about appropriate course placement, we need to ask whether the student should be in enrichment classes or receive interventions. Sometimes they're used for special education eligibility. Some examples of norm reference tests that might be familiar to you are NWEA and even the SAT, PSAT, and college placement exams. Think now about a criterion reference test. It is a criteria, or a checklist of skills on which we want to assess a student. The goal here is not to compare a student to his or her peers, but to determine if a student has made progress or mastered a specific set of skills. So with a criterion reference test, we don't necessarily need a group or a norm with which to compare the student. What we're looking at is, did they get the item right or wrong? Did they master the skill or not? So often with these types of assessments, they may be teacher-created because the teacher has a specific focus on assessing whether the students have mastered what they've taught in that unit. It could be a program test that comes with your math curriculum, or it could be a unit or an end-of-chapter test. But again, the purpose here is to see if the student has mastered a specific set of skills. These types of assessments could be scored in a variety of ways, but oftentimes it is an overall percent correct. So from a criterion reference perspective, if a student had 70%, we know that they correctly answered 70% of the items. It doesn't tell us anything about how they are comparing to their peers. Students who receive a 50% correct got half of the items correct, and therefore likely need some remediation. So again, the purpose for each of these assessments varies, and the scores paint a very different picture of a student's academic performance. Now, thinking about different types of assessments and setting criterion and norm reference aside for just a moment, we're going to talk about types in terms of what kind of information we are trying to find out as educators about our students. And the three types that we'll be exploring are universal screeners, progress monitoring tools, and diagnostic assessments. As we talk in depth about each one, it's important to know that in this section, we're talking about diagnostic assessments. We are not talking about a formal diagnostic battery that a school psychologist might use to determine eligibility. We'll start off by saying that we tend to overassess our students. The reason this happens is that we often don't understand the difference between the type of assessment and the information it's designed to give us. And oftentimes, we're administering assessments that don't give the information we need, and then we have to come back and add additional tools to our assessment model. If we better understand how these tools can be used and what their purpose is, we may end up in a situation where we can reduce the number of assessments that we're administering to students. This will increase the amount of instructional time available to us. Let's start off with the universal screener. Universal Screener is designed to be an assessment that is quick and easy to give. This is important to note because a universal screener, by design, should be administered universally or to all students. So this is an assessment that we want to give because we're asking the question, who is at risk, who is on track, and who is probably in need of enrichment. If we want to get that broad picture of our student population, we need to administer it to everyone. So again, universal means that it's given to everyone. It does not tell us what the student specifically needs. It's only identifying those layers of risk: minimal risk, intense risk, no risk, or in need of enrichment. Staying with universal screeners for a moment, let's look at the audience and the purpose, and then we'll go over some examples that might be familiar to you. For a universal screener, the audience is all students. Some of the examples we'll be talking about today are the more targeted audiences of kindergarten through second grade, all students in those grades. The purpose is to identify who is at risk so that we can get those students placed in interventions as quickly as possible. Typically, when we administer universal screener, most universal screening tools that were created and published were designed to be administered more than once a year. Typically, they're given 2 or 3 times a year, so maybe beginning, middle, and end of the year. If our intent is to identify students who are at risk, those students who are at risk at the beginning of the year may not be at risk in the middle of the year if we've intervened appropriately. And in the middle of the year, we need to make sure we've made progress with them. On the flip side, students who are not at risk at the beginning of the year may fall back. If we only assess them at the beginning of the year, we may not realize that those students are now needing instructional support and falling further behind. Most universal screeners are done multiple times a year, and because they're given to all students, it's important that they're quick and easy to administer, typically less than 10 minutes. On that point, those assessments that are administered one-on-one or face-to-face often have fewer items to assess because of the time commitment. Whereas those students who are able to take a computerized universal screener may end up spending more time in the assessment because it's not taking up the manpower needed to assess students individually. So NWEA would be an example of that. It is definitely lengthier, but again, because it's computerized, it is possible to do more assessments than are able to be administered in a DIBELS or an AIMS web assessment that's administered one-on-one or face-to-face. The next type of assessment we'll talk about is progress monitoring. Progress monitoring assessment can be made up of lots of different tools. In order to understand that, let's start with audience and purpose. The audience is typically all students within a grade, but not equally. Our intent is to assess more frequently those students who are at risk and receiving interventions. The name progress monitoring tells us that the purpose of the test is to determine whether students are making progress in instruction. So students who are just receiving core instruction may benefit from progress monitoring in between the universal screening windows. For instance, if they were screened at the beginning of the year and they are not at risk, and we're not going to screen again until the middle of the year, we might want to periodically administer a progress monitoring tool to make sure that they're still on track for being on grade level. For those students that we already have concerns about, we will progress monitor them more frequently. Again, just to make sure that the gap isn't widening, and also to make sure that our intervention and instructional plans are effectively helping the students catch up. For those students who are most at risk, we recommend progress monitoring them as frequently as every 2 to 4 weeks. At the bottom of your screen are samples of possible progress monitoring tools. Often these are teacher-created. We have a letter naming tool, Fry word assessment for high-frequency words, pattern-based words, and a fluency passage. These are just a few examples. There are many more options out there. But the reason that teacher-created assessments come in handy here is that if the purpose is to gauge whether students are making progress, then the tool needs to be designed so that it matches the instruction. If, for instance, I've been working on teaching students about open, closed, and magic E-syllables, I might not be able to find an assessment that does that for me. I may have to create one myself so that I know if students have mastered what I've taught. Progress monitoring tools are most likely not going to be norm-referenced, but they are going to be criterion-referenced. They can be packaged products or teacher-created, as well as quick and easy to administer. And the last type of assessment we want to look at is a diagnostic assessment. These are not the formal diagnostic battery of assessments that a school psychologist or evaluator might administer. Instead, these types of assessments are intended to drill down and identify students' skill strengths and weaknesses so that we can design our instruction appropriately. When we administer a diagnostic assessment, it is typically not given to all students. Our audience is instead that targeted population of students that we know are at risk. That's because our purpose is to find out what the instructional strengths are, so that we don't waste the students' time teaching them skills they've already mastered. That allows us to design our instruction around the needs that we've identified that a student has and needs instructional support to develop through the diagnostic assessment. When you administer a diagnostic assessment, it tends to be lengthier, and the reason for that is that we must identify which skills the student has and which ones they don't have. The diagnostic assessment also must be thorough. If we want an accurate picture of whether a student masters a skill, there should be at least 10 items working on that skill. For instance, if I'd like to know if students know magic E-syllables, I should have at least 10 opportunities in the assessment for students to demonstrate whether or not they have mastered that skill. If I have a limited number, maybe 5, and a student misses 2, they probably don't have that skill. Whereas if they only miss 2 in a group of 10, I have a different picture. 10 or more items that are very skill-specific, that's the purpose behind diagnostic assessments. Now that we have that background, we're going to shift our focus on understanding the new Indiana legislation around dyslexia screening. To recap universal screening, remember the idea is that we assess all students. The assessment is quick and easy to administer, and it's intended to identify those students who are at risk. Because the purpose of a universal screener is to be able to support students in getting effective interventions, you'll hear us reference the RTI model that is used as a reference tool in the dyslexia guidance document released from the Indiana Department of Education. Senate-enrolled Act 217 is designed to make sure that schools identify students who are showing red flags of possibly having dyslexia characteristics. That allows teachers to be able to intervene early so that these students do not continue to fall further behind. In SEA 217, the guidance is given to schools to universally screen all students in kindergarten through 2nd grade each year within the first 90 days of school. Any students above 2nd grade that the teacher has concerns about or that have had a history of academic failure may also be screened. Universal screening for SEA 217 is only required to happen once a year, unlike the universal screening tools that are recommended to be administered 2 to 3 times a year. All universal screening tools must include all 6 of the sub-skills listed at the bottom of your screen: phonological and phonemic awareness, sound symbol correspondence, alphabet knowledge, decoding, rapid naming, and encoding skills. While these skills look different at different grades, it's up to the schools to determine how each of these skills will be assessed, and to make decisions about grade level appropriateness when selecting measures. The Indiana Department of Education has published an approved list of screening tools. The local school may determine the criteria used to identify students at risk or at some risk for characteristics of dyslexia. IDOE strongly recommends that schools use the indicator provided by their assessment vendor based on the test design of the universal screener. However, schools may elect to adjust the criteria for various reasons. More information on those guidelines can be found on the IDOE's website within the Dyslexia folder. Universal screeners generally have a composite score and a number of component scores. In guiding instruction and monitoring progress, it is important to interpret the overall score and the various components. How component scores are combined for a composite score varies based on time of administration. If one ignores the component scores, unpleasant surprises may await when a high-scoring component is dropped or weighted differently in the composite calculation. We'd now like to explain some of the sub-skills that are included on the list for assessment in universal screening. One is phonological awareness and phonemic awareness. Phonological awareness develops before phonemic awareness. So we may find that kindergarten students need to be administered measures of phonological awareness, whereas second graders would need more phonemic awareness. Schools will be making decisions based on their population and what's developmentally appropriate. Some examples of these skills would be for sound fluency, which is kindergarten appropriate, and phoneme segmentation fluency, which would develop a bit later. The next subskill is sound symbol recognition, or alphabetic principle is another term you might hear used to represent this skill. This is designed to make sure that when students see letters or letter patterns, they can connect the appropriate sound. This might be assessed through a nonsense word fluency assessment or a pattern-based word list. Another subskill is alphabet knowledge. Alphabet knowledge is being able to recognize and appropriately identify letters. Letter naming fluency would be a common assessment administered to identify if students have established this skill. Letter naming fluency is different from letter recognition, as it adds that component of automaticity. Another subskill is decoding. Decoding is the ability to be able to read accurately and automatically. Decoding could be administered through a pattern-based word list or connected text through oral reading fluency. At kindergarten level, this might take place through a pattern-based word list, but at second grade level, it would likely be a connected text passage. Rapid automatic naming is a subskill designed to measure students' processing speed. The purpose of this assessment is to see if the processing is part of the academic struggle that a student might be encountering. The Rapid Automized Naming Assessment is primarily used by most districts as the tool to measure this skill. Encoding is the skill of spelling. In different grades, encoding may be spelling individual sounds in kindergarten, or it could be ramped up in second grade to be able to spell complex words that are multisyllabic or have suffixes. Another layer of SEA 217 is the guidance on administering Level 1 and Level 2 screeners. You will want to ensure that you are using an IDOE-approved Level 1 and/or Level 2 screener. On the IDOE's website is a flowchart that provides some good visual information about the process. A quick summary of the process is that any student who shows up at risk with the universal screening tool can and should be administered a Level 1 screener within the first 90 days of school. The Level 1 screener is more diagnostic in nature and is intended to help identify which skills students are lacking so that interventions can be appropriately designed. In order to administer a Level 1 screener, parental consent is required. Level 2 screeners are more formal assessments. The Level 2 screeners are those that are intended to determine eligibility. Therefore, Level 2 is often part of an MTSS process, or an overall evaluation meeting at the school that involves the school psychologists and other resource personnel. As part of SEA 217, students who have exhibited possible dyslexia red flags and may go as far as Level 1 screening need to be progress monitored frequently to make sure that the intervention is working. Any students who are failing to make progress may go ahead and be screened using the Level 2 screening to determine eligibility. Again, progress monitoring is important for all students just to make sure that they are meeting instructional goals and keeping up with grade level expectations. We've spent some time talking about the universal screening requirements for SEA 217. We've talked about the idea of a flow chart giving us guidance about when we move from our universal screening to our Level 1 and Level 2 screening. This takes us back to the topic of diagnostic assessments. Those students who have revealed red flags for dyslexia should be administered an IDOE-approved diagnostic Level 1 screening tool. Once parental consent is received, it's the role of the school to find the instructional strengths and weaknesses of the student so that appropriate interventions can be designed and delivered. The Level 1 diagnostic must be administered within the first 90 days of the school year. The MARF Reading Foundation Screener and the MARF Phonics Screener, which is referred to as the MPS, are both included on the IDOE-approved list for Level 1 diagnostic screeners. Specific questions that the diagnostic assessment should answer are: what type of supports does the student need? What are the skill goals for this student? And what kind of instructional strategies would be most beneficial? We'll explore how these tools help us answer those questions. Depending on the age level of the student, if they are in second grade and up, we often recommend starting with a fluency assessment. This fluency assessment will at least give us an indication of how far below grade level the student is and what is likely the problem. Are they having difficulties with accuracy? Is it more related to rate? Have they established bad habits of guessing? What kind of awareness do they have of high-frequency words and automaticity of those as well? From there, we may go ahead and drill down and do a quick phonics screener. We'll start with a sound assessment to see how well students know sounds in isolation. And then we would move to administering a pattern-based word list to see what their knowledge is of specific syllable types. We may also want to administer an assessment to understand what their alphabet knowledge is, as well as their awareness of vowels and consonants and the roles they play in words. We then shift to the encoding components. We might start with an auditory drill to see how they're able to spell sounds in isolation, and then shift to spelling pattern-based words or irregular words. If we suspect some foundational issues, such as phonemic awareness, we may want to drill down and do that as well. As we make decisions about diagnostic assessments, we don't need to assess students on everything. We only need to assess them on what we suspect might be the underlying cause for their difficulty, so that we know where to begin instruction. This concludes the assessment overview of training.